Welcome to MomFit with Joe Peters um, in the Spanish World Network and the H.E.R Network single TV channels 250 and 251. Please remember to download the single TV app in the respective app stores in iOS and Android devices. While you are downloading, make sure that you rate the app. The app is free. Single TV is available in Google Chromecast, Amazon Fire, Fire TV, Roku, and all Roku sticks in all smart TVs since 2016 and in all your computers. Today, I am super excited to have Jessica here. I cannot promise that I will not get emotional at one point in the episode because Jessica Jessica Miller is a myofunctional therapist and registered massage therapist. And she has a specialized training in manual osteopath and craniosacral therapy. She's on a mission to support whole body health and family health by supporting oral, motor health, and airway. And some of you mamas are saying, what is oral, motor health, and airway? And we're going to learn a little bit more of that. But that is what commonly is called tongue tie, lip tie, and is a restriction in your mouth. In babies, that is what we're going to be focusing today. This type of dysfunction can show up as difficult for feeding from the breast, reflux, issues sleeping, and if it's not corrected on babies, that could move into being an adult, and in adults can be shown as jaw pain, clenching, grinding, snoring, headaches, mouth breathing. And Jessica knows all this because she handled these paths with her and some of her daughters. She navigated tongue tie treatment by herself and her daughters, and also after that with her clients. She believes that curiosity is one of the most important skills in motherhood and navigating a healthy journey. Sometimes you need to look far and wide to find the most helpful and relevant answer. So, Jessica, welcome to the show. And thank you for taking time on your busy day to actually talk with these mamas around the world about tongue tie and how can affect simple things like breastfeeding, reflux, sleep, and the infancy of a baby. So, welcome. I would love if you start with maybe telling us a little bit of your story and how this passion and mission for helping moms and babies start with you.
Yeah, well, thank you so much for having me in your busy day as well. I appreciate the opportunity to be here and talk about this subject because I am so passionate about it. It's not something that I really knew anything about until I had my daughter. So I have two daughters. One of them is in kindergarten right now, and one of them is 1.5 years old. And when I had my first daughter, um, you're overwhelmed with the beauty that life is when you have a squishy little baby in your arms. Um, but everything wasn't perfect because it was very difficult for us to nurse. Um, Nursing was something that I really wanted to do as long as possible. But it was really painful, and I didn't expect that it would be painful. I didn't expect it would be easy, but I didn't expect it to be painful, and so I really wanted to figure out how um, to solve that problem. And what I realized along the way is that it was painful for me because her latch was really shallow. Um, and when her latch was shallow, it just was stimulating in the wrong spots. And um yeah, this happened because the mobility of her tongue was not able to have me sucked in deeper into her mouth, if that makes sense. And so she was basically kind of like chomping on the tip of my nipple the whole time. It was brutal. And often for other moms, like, I work with lots of other moms and they'll have this experience and then they start to get sores and broken skin on their nipple and they don't know why that's happening. They just think, oh, well, baby just needs to learn how to nurse. And that's that's not really the case when the mobility of the tongue is not available to nurse properly. So that was the starting point for us, and that sparked this whole passionate journey of mine to work with babies and help with airway health and oral motor. So oral motor meaning learning how to use the muscles in the face and the mouth in a coordinated and healthy way. Mhm.
And thank you for that. And I resonated. I think that I was so excited when we talk about you being a guest on that show, because I experienced the same. Actually, you were a little ahead of me because you at least were not expecting breastfeeding to be easy. I did, because the only thing that I saw in social media and in shows and everything was moms with their newborns just being happy like a lettuce on breastfeeding. So I always assumed that was something natural, and because it was natural, it would be easy. And
Mhm.
we had issues. My issues, thank goodness, were not about my pain. My issues were about him not able to extract enough milk from my breast, so he was not gaining weight,
Mhm.
and my milk was not coming because he was not pulling it out. And I actually remember the same thing of like, it should not be this hard. And then when I find out from somebody in my area like you that he had a tongue tie, I was so frustrated because I was like, I never even hear about this when I was pregnant. I didn't even like this was not even visible for me as something to look for. And it broke my heart because I thought how many moms in the first weeks face something like I did or you did, and either because of pain or because their baby is not gaining weight, the solution of the doctors is, oh, move it to formula, and then completely ruin their breastfeeding journey
Mhm.
because that diagnosis was not proper and on time. So this is a topic very, very close to my heart. Let's gonna talk a little bit about like what a tongue tie is and how it can impact babies, and then for all the mamas here that start thinking what I did wrong or what I can do to avoid this, to actually get that peace of mind on which babies had tongue ties, and if
Yeah.
it's genetic, if it's not. We're going to talk a little bit about all that.
Yeah, so first off, just to say, like, if you're a mom and you're feeling like you're doing it wrong, stop thinking that because momming is the hardest job in the world and we're all doing our best. And there's so much to know out there. And how can we possibly know it all? So, whatever you're doing right now, you're doing your best, and that is good enough. And so, in this world, it's very exciting that we have the opportunity to learn more. And so, let's talk about what tongue tie is so that if you had a hard time breastfeeding your baby, or you have a friend or somebody in your world that you want to help them out, this information might be relevant. So when we talk about tongue tie, there's a piece of tissue called the frenulum, which is under the tongue. Everyone has it. It's normal. And so it's that little piece of tissue under the tongue. And what's different from person to person is where it attaches on the tongue. So, how far forward or how far back, and then where it attaches to the floor of the mouth. Again, how far forward, how far back, and how long is that tissue, and what is the elasticity and pliability of that tissue. And so, those are things that are different from person to person, because genetic variation is a beautiful thing. But what happens in normal swallowing, sorry, let's talk about normal resting position for the tongue. The tongue, when we're not talking, when we're just at rest, sleeping even, it should always be all the way up on the roof of the mouth at rest. This is normal, but for many people, we don't have this as our normal experience. And you don't know that something is not normal because you don't think to talk about where is your tongue resting. It's not the common conversation. Thinking about your tongue, where it is, how it's moving is not a common conversation, or something that we spend a lot of time thinking about. So we just think, okay, well, this is my body and it's normal. But if it's resting on the floor of the mouth, which you can tell easily with babies, if your baby is sleeping, you can just open up their mouth and see if their tongue is up like that. That's a really good thing. If it's not, it makes you put up a little alarm bell. Why is my baby's tongue not in the normal, healthy, physiological resting position? Well, he's resting. And so with tongue tie, for those babies or adults, because a lot of adults have it untreated. I had it untreated in myself until I was 38 years old. The tissue is either too short or attached too far forward so that the tongue is not able to rest on the roof of the mouth. You're not able to have a healthy and normal swallowing pattern, which healthy and normal swallowing pattern is fully on the roof of the mouth. When you have a dysfunctional swallowing pattern, you end up pushing your tongue against your teeth, either in the front or on the sides or in between the space between the teeth, top and bottom, to initiate a swallow. So the tongue ends up pushing forward instead of having a vertical wave. So that's a lot of information to unpack there. But just to say that there is a normal, healthy way of resting position for the tongue, and there is a healthy way of swallowing. And that's what I look for in the people that I work with, to help either, the early life experience of mom bonding with baby, or later on in life when other symptoms start to crop up, like jaw pain or neck pain, those kinds of things.
And I love that because a couple of things that I want everybody to understand is, and this is what is so important to have knowledge on people like Jessica and go and be addressed. And one thing that I learned in my own experience is I love and respect pediatricians. Pediatricians are not completely trained to diagnose a tongue tie and a lip tie. It needs to be a dentist, ETN, a person that had training on that. Why I'm telling you that, Mama? Because if you hear Jessica and you, for example, I never thought about the sleeping, but one of the things that I've noticed with my baby is when he was crying, he will be open mouth crying and his little tongue was not able to reach. Like you can see that his little tongue was holding back.
Mm.
And if you see any of those things, you can go to your pediatrician. And unfortunately, because a lot of them don't have enough information, they will brush you off and say,
Mhm.
it's okay, don't worry, just give them a little bit of formula. Not because they are bad, it's because that is not their area of expertise. So I'm inviting you to actually know that and know if you have concerns, make sure that you are discussing those concerns with an expert in the topic so you can actually go and have the release. And actually my baby tongue tie, because my baby had the tongue tie and he also have his top lip tie. So he was not able to swallow with his tongue, but he was also not able to open his lips properly to latch.
Mhm.
We revised that at 6 weeks old. And then around 13, 14 weeks old, I start getting again paranoid and I was like, maybe the tissue grow back and we need to do it again. And what I did was go back to the dentist place that released it with laser, and then they review it and say no, and they show me the pictures and have a lot of ways to actually give you confidence of it is or is not. So I
Mhm.
want to actually add that because it's sad that sometimes we think that our pediatrician is that one person that can know everything about breastfeeding, sleep, health. And the reality is there are areas that they really don't have enough education in medical school to support our journey as moms.
Absolutely. And I'll just add to that, at least where I am. So I live in Canada. And I expect it's very similar in the States based on what you just described there. Um, but doctors and pediatricians don't receive any training on tethered oral tissues. So that's the more medical term to explain um, tissues in the mouth, like the tongue, like the lip, and even along the cheeks that are restrictive. And so, a good question, we want our doctors have the hardest job in the world, and I just send a lot of respect to them. At the same time, I just want to make sure that families who are asking these important questions and they're in a vulnerable time in their life are getting the answers that they need from the person that they need. So, if you are going to your doctor or your pediatrician and you're asking for advice on this topic, I urge you to ask them first, what continuing education did you take on the topic of tethered oral tissues? Because that way, it it's a little bit disarming in the sense that now you're on the same level. They're not, there's often with doctors, we have this feeling that they are the grand authority on any topic that you ask them a question about. So knowing what information that they have about that topic before you ask them their opinion on a topic can help you have a more level conversation with them. I had that same experience with my own pediatrician. So in Canada, babies don't just have a pediatrician. You only get a pediatrician if there's a problem, and then you get referred on to a pediatrician. And I asked her, I didn't think to ask what additional training do you have in tethered oral tissues, and I just asked her if she could evaluate the mouth. And the information that I got from her was a bit disheartening, because what she had said is that in 20 years of practicing, she had never once thought that it was important for a baby to have treatment on a tongue tie. And for me, she was missing the mark with me, because in my own health story, at 38 years old, when I was experiencing chronic pain my whole life, I had my tongue released. And that, especially in conjunction with all the myofunctional rehab, like all the learning how to use the tongue properly after having that release, those two things together was the most meaningful health intervention that I have ever had, and resolved many of the issues that I experienced. And so for my pediatrician tell me that it was not an intervention, to me, I just knew that that was wrong.
Yeah. And again, it's matter of us understanding and respecting our team. One of the things that I always say in MomFit is we need to have a team around us as moms. And it's
Mhm,
like I always make the analogy with a sports team, like and a coach that is coaching a sports team. That coach is not doing it all. That coach had a team around him. The person that is expert on legs, the person that is expert on arms, the person that is expert on offense, the person that is expert on defense. Actually, that was one of the things that fascinated me when I was learning is that I learned that the head coach is not the coach that coached the team on their offense and their defense. He actually have a coach that is expert on offense and a coach that is expert on defense. So how I
mhm,
like to see moms is you are the head coach. You are the head coach of your life and your journey with your baby. And then it's important that you set yourself with a team. Will that mean that one person in your team is more important than the other one? No. Does that mean that you don't need a pediatrician in your team? Absolutely no. Pediatrician is one of the key team members in your team. That just means that it will be as crazy for you to only have a pediatrician as part of your team as crazy as would be for a head coach of a medal gold medal champion team to have only one support person. We
mhm. I
will
love
never do
that
that in a
analogy.
sport. So
That's great.
if a team said like, oh, a coach says, oh, I'm gonna fire my entire team and I'm gonna just leave my right hand, everybody will be like, what are you doing? It's the same with us as moms. So yeah, you need a pediatrician. You need somebody with experience in craniosacral and osteopathy, an expert on these things. And one of the things that I want to invite you to do that I always do in my shows is, this is my engineer mind. Proactive and preventive will take a lot from your shoulders. One thing that Jessica said, and I want to point back into that, is the fourth trimester is the most vulnerable and delicate time, I will risk to say, in your entire life as a woman. Very close to adolescence and menopause. But matrescence, that is the fourth trimester, is because you are learning a new life. Your hormones are all the way. So my advice is connect and learn about things like tongue tie and lip tie, and make sure that you have somebody in your area like Jessica that is expert in that topic when you are pregnant. So you have them almost like is in your team, but on call in your team. You have the connection, you have the information. If your baby come and you are breastfeeding magically amazing without pain and everything is working amazing, we are so happy for you, mama. Game on. And if you are having challenges, you are not trying to think logically and rationally and looking for answers in the middle of the most vulnerable time of your life. You are only going to be like, oh, yeah, let me look for Jessica's phone. I already know Jessica. I already talked with Jessica. And I will just take a phone and say, hey, Jessica, I need to go and see you because I'm having some issues with pain breastfeeding. Or like me, hey, Jessica, the baby is losing a lot of weight, is not gaining enough weight. I want to go and check with you. So it take you from the reactive, additional stress, additional cortisol. You will not believe how many nights I cry my eyes out in the first 6 weeks until we revise him, when all of that could be prevented. You had enough in your plate, mama, to
Mhm.
add additional things that could be more preventive, because if you have the information, if you have the contact, then the story will go different.
Yeah, and, adding on to that, I would just say, we don't necessarily ever want to just jump into the idea that surgery is the answer, because I firmly disagree with that. There's other things that can happen first that are important to try. So this can help grow your team as well. So having a lactation consultant that you can call, have a virtual visit with, or an in-person visit, so that they can see that you're bringing your baby to the breast in a way that is supporting milk transfer. And then the craniosacral osteopathy massage therapy kind of piece of the puzzle, working with a baby hands on, can help reduce tension in the neck, in the head, in the shoulders, and other places that can really have an impact on how the tongue moves. And so it's important to address those tensions first and make sure that it's not just body tension that's making nursing a difficult experience, if that's what's happening for you. And just check off those boxes first.
And one thing that I want to also point out with what you're saying is that I remember with E, the doctor, dentist, actually give me a scale and say, you can have tongue tie and lip tie 0 to 10, 0 being you don't have any, 10 is you have a very restricted movement. And then she said the same that you said, like, I will not recommend surgery if it's anything below a 6, because the impact in their life will not be as much, in her opinion. And then she told me that E was at 7.5. She was like, it's not the most extreme, but it's enough that is causing challenges. And one thing that I love about the osteopath and craniosacral therapy that you are talking, and for the ones that don't know this, is a gentle touch, somewhat like a gentle baby massage that Jessica does on the baby's head and the baby's back to help with tissue that sometimes get stressed through birth,
Mhm.
to relax. But another fascinating thing that happened with me and E is that she was telling on herself, but with babies it's the same, is after the tongue tie is released or the lip is released, they need to relearn how to suck. They need to relearn. So I will tell you my story. My baby tongue tie was released at 6 weeks, and it was not until week 16 or 18 that I really start seeing a difference on how he was feeding. Actually, I remember freaking out because of the tongue tie. When I was the first couple of weeks, he will take full 30 minutes in each breast. So I will be like almost for an hour breastfeeding him because he will do it and will not be able to suck enough milk. So I moved from almost an hour to then around 30 minutes or so. And then around 18 weeks, one day he just started nursing for like 5 minutes, 4 minutes each breast. And I was freaking out because again, I didn't have, so I was like, oh my God, there is no milk, something is wrong. And then I get somebody like you support me and say like, no, he's finally, after all this rehabilitation of his mouth muscles, he's finally learning in a very effective way how to handle all his muscles properly, so he doesn't have to work as hard for 30 minutes. He just go to business for 5 minutes, everything is working good, and he's like, I'm done, mom.
Yeah,
So
and for a lot of babies, parents, when it takes so long, parents will just say or think, "Oh, I've got a lazy baby," like, it just nurses for a little while and then falls asleep, and that on its own is a warning sign, like, babies are not lazy. They want nourishment all the time, or when they're hungry, and if they're falling asleep at the breast, that's a warning sign. And here's an interesting thing as well, because, as I found with my first daughter and also my second, but at the time of this story, it was just my first daughter that she had a tongue tie. And I realized that there is a very strong genetic component to tongue tie. And so I encourage every family who's noticing that their baby has a tongue tie to turn the mirror towards themselves and find out which parent also has a tongue tie, because there are likely things happening in your own health story that could be improved with myofunctional therapy as the first intervention to see, okay, maybe we can reteach your tongue to coordinate in the right way. Um, and for me, it was just like a brain explosion moment, because I had realized that for my whole life, I was living with 25% function of my own tongue, which is insane. Yeah, it still surprises me that I could get through a whole life with barely even being able to move my tongue. Yeah.
that is fascinating, and is that part of our journey as parents, right? And I love how you are touching in that point that we're talking is, do can I do anything to prevent my baby to have a tongue tie or lip tie? The answer is no. It could be genetic, and the reality is the only thing that you could do is early
Mhm.
diagnose, because the reality is as early you do it, as easier will be for them to relearn, and then will not be like Jessica that had to figure out, because the reality is our body is magical, right? So if you have that restriction, your body is going to figure out a way to compensate.
Yeah.
And then, but that doesn't mean that is good. That means that your body is spending a lot more energy trying to compensate and balance that lack. So as easy as sooner it is detected, as less of that energy your baby will have to spend. One other thing that I want you to touch base on is, because I think we have been talking about them, like a couple of the signs are pain in the breast. And I think that you and me can agree that if is hurting you to nurse your baby, then please, mama, that is not normal. Like that, it is not like that's part. This is part of the job.
Mhm.
Painful breastfeeding should not be. The other thing that I hear you saying is if it's bleeding, if the baby breastfeeding is actually causing hurts and wounds. The other one that I told you that I think about you saying that it was like that was probably the thing that killed my heart, and I even have PTSD on that one, was because for moms it's like, oh, he fell asleep in the breast, he's not hungry. And then when I learned about it, they were like, no, he's working so hard and he's not having enough food, that he's actually shutting down and falling asleep to save energy. And
Mhm.
that break is going to make me emotional. It breaks my heart to know that my sweet baby was falling asleep because he was so hungry that he could not do it, and I was not aware of that.
Mhm.
So that is another one. And then the other one is gaining weight. If your baby is not gaining weight in the way that it should, so thing that does for
And that last yeah, so that's 4, and there's a few more, and I can go over some of them, but that last one that you just mentioned, the not gaining weight, that one, our our support team usually catches that one a little bit more easily. But then there are the babies who don't have a problem gaining weight because mom has oversupply. So if you have painful oversupply, where I mean, you can feel it, you're always engorged. And then sometimes baby will end up having green poop because of that, because there's too much fore milk, then the baby might be gaining weight fine because the milk is just has a fast letdown. It just comes, it just like is like Niagara Falls into your baby's mouth. So that's another that it's like not enough milk or too much milk. And so other symptoms in babies to look for is, maybe the nipple ends up having a shape like a lipstick top, or maybe your baby's always or not able to maintain a seal around the nipple. And so what will happen is milk will just fall out of their mouth, sort of like you're drooling on a pillow, like milk will just fall out and wet your shirt. Or you'll hear like that kind of noise happening. Even extra gassiness doesn't necessarily mean tongue tie, but but is certainly one thing that's common. So oh, and there's like so many symptoms. For my own daughter, one thing that happened was, at around 3 months of age, babies tend to go through another big growth spurt. Different timing specific for all babies, but my baby went through at 3 months of age, and what happened was she had been sleeping better, and then at 3 months when she went through that growth spurt, she needed more milk than she was getting, and is still too young to be, you don't want to be putting babies on solids until 6 months. And I didn't realize, that she wasn't getting enough milk through that growth spurt. She ended up waking up hourly. So if your baby is having is normal for a baby to not like sleeping through the night is a bit of a myth. So another one of my specialties is is baby sleep. Um, because I dove deep into that, and sleeping through the night is a bit of a myth. It's very, very normal for a baby to wake up in the night. But if they're waking up more frequently than every 2 hours, that's a red flag. You want to find out, why is that happening?
and I love that point. Thank you so much for pointing that out, because that is another one that lack of understanding that is a red flag can lead you into brush it off. And I can see, bless their heart, the old generations saying, oh, your baby is just too hungry, you're not having enough milk, put some cereal in the bottle, or give them some formula and some rice, whatever, in the bottle to make them feel throughout the night. And then first, if you are hearing this around the world, I respect your traditions and your culture. Scientifically, it's been proved that that is a choking hazard for a baby. So if at this point you still are having somebody telling you that, please do your own research, because it's been proved that that tradition and that approach that was happening 40, 50 years ago is actually not safe for babies. But then the other one is, even if you don't do the rice thing but just a big formula bottle, is, yeah, if you are breastfeeding and you give formula, your baby is not going to digest the formula as fast as your breast milk. So yeah, you are going to kind of lead him to not wake up as much, not because you solve the problem, but because you put a band-aid, because now his belly is so full and is slower to process formula that is not waking up as much. Thank you for that one. That is a huge, huge, huge reminder. And one of the things that I want to talk with you is the release part, because I know that there are some families that mom and dad had different opinions about the release,
Mhm.
and there is a lot. Like I remember sitting down, wait, because I don't know how they do it in Canada, but when they did it to E, we choose to do it with laser because we choose that was a little more less invasive, but they took E away, like they didn't let me go with them. They're like, no mama, you're going to stay here. They took him. It literally was like 2 minutes and a half that in my mama brain felt like 355 years. But then when he came back crying and I nurse put him in the breast, I remember crying because I feel so guilty of causing him pain. Because I was
Mhm.
like, oh, this is a surgery. He's going to be hurt. They're going to cut his tongue. So if there are any moms hearing us that are thinking about that and are maybe afraid as me, why we don't talk about that part of the release of that
Mhm.
surgery and then actually how big of a surgery is and how much pain really will cause the baby versus decide to not treat it
Mhm.
and then give some of that data validated information to moms to actually start thinking on their own the thing that work the best for them and their families.
Yeah, absolutely. And I think before when we're trying to make these difficult decisions, and they are very difficult, it's important to understand why we're doing them. And it's, you know, maybe mom is fine with pushing through difficult nursing, or maybe it feels okay to just switch to formula. These are all very justifiable decisions, right? But the thing is that it's not just that it's different anatomy and that it's causing these inconveniences. It is it does lead to airway disorders. So I'll just tie it into the adult situation that can happen down the road, like decades and decades later. And you don't make these choices for your baby because of something that might happen when they're 40 or 50, but just to keep the bigger picture in mind, sleep apnea is also an airway disorder. And so, sleep apnea, and I know I'm not answering your question, but I'll get back there. So, sleep apnea happens when you're sleeping and your airway closes off, and then you have to gasp for breath. And this gasping wakes you out of your sleep. And now I might be just describing this a little simply, but basically is that your airway is closing off, your tongue falls to the back of the throat, all the soft tissue just collapses to close the airway. And this happens if because the tongue is not in part because the tongue is not up on the roof of the mouth. And so we can see that that is an airway disorder. And that's the same thing that is also happening in our babies. And now you can't go for a baby to a sleep study and have something like that diagnosed, but that's the symptom projection that happens, if that makes sense. And so knowing that you're helping out your baby's long-term health to coordinate the tongue so that they don't develop um, these kind of extreme health scenarios is an important thing to keep in mind. So that you're yeah. So then back to the surgery. I mean, honestly, as a mom who's gone through it with my first, I also felt like it was 700 years when she was taken away from me for the like 2 minutes that it took to do the surgery. And then with my second daughter, we we waited a little bit longer because again, I don't like so we waited until she was about 14 months around there. that's a really awkward time to do it. Way better to do it early on. But we wanted to make sure that, the issues that we were experiencing with her were really related to the tongue, because hers was did not seem as severe as my first daughter's, and we didn't want to have a surgery if it wasn't indicated. But with her, we did the surgery with me there holding her. And that was also very difficult. But again, it took 1 minute. There was like no bleeding. So it's, our brains almost catastrophize these kinds of situations. And, that's okay. We're going through a lot. For myself, as an adult having the surgery, also, like, it was like a 2-minute procedure while I just had some local anesthetic and, yeah, just over like that. So with babies, they put a numbing gel on so that they don't feel any pain, um, and that seems to do the trick.
And one of the beautiful things on this, and I want to touch about this also on that taboo of everybody giving you their own opinion, right? So Jessica has been telling you all the symptoms. Your baby can have one or two or all of them. And then what we are trying to give you is almost like pinpoint things for you to gather them and then advocate for yourself and your baby and say, okay, I'm now listening that it's not normal to have pain. It's not normal for my baby to wake up every hour. It's not normal for my baby to gasp and not being able to have this. One thing that I want to share, and I don't know if you have experience with any other mom like me on this one, but um, there is conception because a lot of mom this happen, and that is if the lash is shallow, then it should hurt you breathing, breastfeeding. And one of the things that happened to us was that people were like, "Well, I think that is a little shallow, the latch," but I was not hearing, I was not having any kind of pain
Mhm.
the first couple of days. So because everybody was saying, "Oh, if it's shallow, it has to hurt," I was like, "Well, it's not hurting,
Mhm.
so I'm okay." And one of the fun things is even after he finished latching, and this is one of the things I want to close with you on that the rehabilitation goes beyond the release. We did the rehabilitation, and I truly believe that he is not able. And I'm after talking with you, I'm gonna try to find another person to see if we can keep that rehabilitation. He didn't learn completely how to do it because his latch is still very shallow.
Mhm.
He doesn't stay in the boob too long. He just do a couple of swallows and move from one side to the another. But then one of the things that happened was I started having a lot of shaming and a lot of people, a lot of other moms when I was doing my videos about breastfeeding about, oh, that is such a shallow latch. That should be so painful. And I'm like, no, it's not.
Mhm.
And then like, oh wow, that is another good one about motherhood. Oh, you should be covering yourself if you are breastfeeding your kid. I was like, my kid had an issue in his mouth. He cannot be more than like literally 20 seconds on each breast. It would be like almost impossible for me to have a cover and then pull him 25 times from side to side under the blanket. If my baby's like yours that just nurse for 10 minutes on one side, finish, and then move, okay, I will explore covering myself. But my feedings with my baby are like a
Yeah.
gymnastic, like your group event. So that is another one on I want to talk with you as we start closing up on you talking about that, like what is happening after the surgery
Mhm.
and how moms can keep following into knowing that the muscles get completely rehabilitated. Keep rehabilitation of the muscles is being completely done and properly.
Yeah, absolutely. Yeah, and I mean, I'm sorry that you went through that with the feeling of, oh, judgment around breastfeeding. I live in a place that seems to be a lot more progressive, and we have a lot of babies, so I never felt I could nurse wherever I wanted to and never felt that. I feel so lucky that that was my experience. But there does seem to be a lot of mom judgment out there, and I think part of it boils down to the vulnerable state that we're in. If we're not rooted in knowing that this is what we value for our family and this is just what I'm going to do, that that feeling of judgment can penetrate so much more easily. And so rehabilitation afterwards. So it's a spectrum of care. And so after if you're if we're working with a baby after the surgery, we always want to be making sure that we're doing aftercare wound care. And this is who you would talk with your release provider about what this is like. But it involves, when we're thinking about function of the tongue, and the tongue moves in a wave-like pattern and has to reach the roof of the mouth for normal swallowing. So we need to have that vertical dimension underneath the tongue. And so that's what we're trying to achieve with the release. This is a functional release, right? So we want to be able to, the aftercare involves opening that wound every 4 hours. There's different advice out there about how frequently it should be, but so that we maintain growth, the scarring in that vertical dimension, because there's something called wound contracture. So if under the tongue, this was where the wound is from a laser or scissors and suture, or just a scissor release, when that's healing, it contracts on itself like that. So it's closing up, and we want it to contract like that in a vertical dimension. So you have to do the aftercare. And so that is very important. And then, you assess your function along the way as your baby's aging. Are they still managing well within their mouth? How does feeding go? Like, once you start introducing solids, are they able to move the food around in their mouth? And here's where you would, if they're not adjusting to solids very well, this is when you would work with a feeding specialist, who could be an occupational therapist or a speech and language pathologist who specialize in infant feeding, and just making sure that those motor skills are integrated. And then by the time they're 4 years old, that's when you can maybe start, if it's needed, start myofunctional therapy if you're noticing that they're still having issues with swallowing, or because it's a spectrum of like continued care. I don't know if I explained that well there, but mhm.
I love it. I love it. It is that part of like that. There is not an all or nothing mentality.
Yeah,
So I want also to close the program. I think that two main takeaways are: first, there is something called tongue tie, lip tie, that can be released and revised very easy and will impact the quality of life of your child immensely as an infant and for their entire life. And then the other one that you said is, it also, it's clear that is a journey. So it's not like, oh, I did the surgery and then all the problems are going away and then magically next day everything is going to be unicorns and butterflies.
Mhm.
It's a journey for them to actually relearn and get used to this new way of life.
Yeah.
Jessica, thank you so much for being here.
Yes.
Before we go, please share. I know that you have a free Facebook group. If any moms are wondering about these and now are like checking the boxes of all the red box, please share really quickly before we finish, how they can reach out to you and your Facebook group.
Absolutely. My Facebook group is called Tongue Gymnastics. Easy to remember. I would love to continue this conversation there. There's so much that we haven't talked about. I'm happy to answer your questions.
Thank you so much, Jessica. And please check out www.spanglishworld.ca for all the news and programming. Spanglish World. Watch it, hear it, read it, Download it and leave it.